Hi guys, welcome back. Today we'll be talking about abnormal breast milk discharge, also known as breast milk leak from the breast. When a woman is not pregnant and is not breastfeeding and she's having breast milk discharge from her breast, or when pressed, is known as Galactorrhoea. When a woman has gotten pregnant, breastfed a baby and stopped breastfeeding, and after 1 year of cessation of breastfeeding, that is, after 1 year she has stopped breastfeeding, there is still breast milk discharge from her breast. It is known as Galactorrhoea. We'll be using the term Galactorrhoea now in this video. So Galactorrhoea can affect women of reproductive age, it can affect men, and it can affect children really. There are different hormones that can cause Galactorrhoea. One, the commonest hormone that is responsible for breast milk discharge is prolactin. Oestrogen can also cause a woman to start having breast milk discharge. Thyrotropin releasing hormones can also cause breast milk discharge. Now, abnormalities of these hormones or excessive increase in these hormones can cause a woman who is not breastfeeding and not pregnant to have Galactorrhoea. So my name is Dr. Adazion. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my channel. If you're not following me on Facebook, please follow me at Talks with Dr-Adazion. Subscribe to my YouTube page at Dr. Adazion at Talks with Dr-Adazion. I'm also on TikTok and on Instagram with the same name, Talks with Dr-Adazion. Hit the notification button, like this video, and share it. Someone may benefit from it. As we were saying, Galactorrhoea can affect women of reproductive age, can affect children as well, though rarely, but can affect men as well, especially men that have gynecomastia, those men that have big breasts, or men that are growing breasts. However, our interest today is about women of reproductive age. What are the causes of Galactorrhoea? Galactorrhoea can be caused by any of these following. One is prolactinomas. If there is any pituitary tumor, remember that prolactin is a hormone that is produced in the pituitary gland. So for a woman that is not breastfeeding, the prolactin production of prolactin is reduced very well. However, for a woman that is breastfeeding, there's increased prolactin, that is what we call hyperprolactinemia. This helps to initiate breastfeeding so that the baby can breastfeed. However, for a woman that is not breastfeeding and there is increase in that hormone, hyperprolactinemia, the causes may be from any of the following. Presence of prolactinoma. Prolactinomas are tumors in the brain. They may be micro, small, or macro, big, in the brain, and when they are occupying that place, they will be releasing prolactin. We'll call it prolactinomas, and the person will have increased prolactin level in the blood, and this will show by breast milk discharge. Now, other causes include drugs. There are some drugs that are associated with prolactin, high levels of prolactin secretions on the body. This, for someone that is on some antipsychotic drug, some antihypertensive drugs, they can cause hyperprolactinemia. And when someone is on these drugs and the person may not know that it's these drugs that are causing hyperprolactinemia, so when someone comes with breast milk discharge, we'll ask the person, are you on some drugs? We find out the drugs that can cause this and see if the person is on it. If the person is not on it, we'll go on to evaluate other things. Other things that can cause hyperprolactinemia include renal failure, because the kidneys are not able to excrete the prolactin that are already released in the body, so they tend to accumulate and will lead to hyperprolactinemia, and the person will come with breast milk discharge. Others include some chest tumors, and sometimes we not even find anything causing it. However, a woman of reproductive age, there may be increase in hyperprolactinemia. Let's assume that someone presents with inability to conceive, and part of the history we'll ask is, I will find out from her history if there is breast milk discharge, and the person agrees that there is breast milk discharge. We'll have to find out where the breast milk discharge, what is causing it. Is it that she has prolactinoma, maybe the small one or the big one? We'll find out. There are some history she will give us. We ask for history of headaches, we'll ask for history of frequent headaches, we'll ask for history of blurring of vision. This one will show us if there's any tumor that is in the brain causing it, especially the big ones. However, tiny tumors may not be noted with symptoms. So during investigation, we can ask the person to do a CT scan, we can ask the person to do head skull X-ray, and this will find that this will show that there are some adenomas, those micro or macro adenomas in the brain causing breast milk discharge. Now, if we do not have that history, we can as well go on to find out if the person has what we call polycystic ovarian syndrome. We found out that those that have polycystic ovarian syndrome, most times they come with hyperprolactinemia. Hyperprolactinemia will prevent a woman from getting pregnant most times. And so that's why when someone presents with infertility, inability to conceive, and we'll see that the person is having hyperprolactinemia, we tend to evaluate the person more and find out the cause. Is the hyperprolactinemia on its own? Is it associated with breast milk discharge, or is there any other thing that is causing it? Remember initially when I said hormones that can produce hyperprolactinemia that can cause someone to have increased breast milk discharge include prolactin, estrogen, and thyrotropin releasing hormones. So we evaluate this person. If a woman comes with inability to conceive, we'll find out what could be the cause of that hyperprolactinemia. Remember initially when I said that when I made a statement initially, I said that there are hormones that can lead to increased breast milk discharge. Number one is prolactin, number one is estrogen, number two is estrogen, the third one is thyrotropin releasing hormone. So for a reproductive woman that is seeking infertility, when you come with seeking for conception, when you come with breast milk discharge, we evaluate for these hormones. That's why most times we tell the person to do a hormonal profile. What we are looking for is to be sure that she has actually hyperprolactinemia. So we're checking for the hormone prolactin. Is it elevated? We are checking for estrogen, because estrogen goes on, high levels of estrogen goes on to prepare the breast for lactation. And so for a woman that has high level of estrogen, especially in cases like polycystic ovarian syndrome, the person may go on to start having breast milk discharge. Now the third is thyrotropin releasing hormone. Someone that has hypothyroidism, sometimes they'll present with neck mass, and you may not know it can cause breast milk discharge. So these are the hormones we evaluate. Then we'll go on to evaluate if the woman actually has polycystic ovarian syndrome, that is multiple cysts in the ovary, making the person not to ovulate. We check the hormone we call follicle stimulating hormone and luteinizing hormone. It's most times if these are evaluated and we'll find out that these are the cause of her having breast milk discharge, it's easier for us to treat. So the patient is fully evaluated, we'll go on to treatment. Treatment is easier, especially if we have found out the cause of that hyperprolactinemia. So we tend to bring down the hyperprolactin with drugs. The drugs are mostly bromocriptine, or we can go further to cabergoline. However, they work by as dopamine agonist, because in hyperprolactinemia, dopamine, the hormone dopamine is reduced. So these drugs will work as dopamine agonists, reducing the effect of hyperprolactinemia. Hyperprolactin level, that is the breast milk discharge, is drastically reduced. Most times, when you are giving the person these drugs for 1 month, you see that the person has sporadic, the breast milk discharge stops and ovulation occurs, and the person can go on with pregnancy. So breast milk discharge can prevent a person from getting pregnant. Breast milk discharge can cause the person to be having recurrent miscarriages, because it may be due to effect of polycystic ovarian disease. So it can cause the person to have recurrent miscarriages. Hypothyroidism itself can also cause person to have recurrent miscarriages. So these are the things we evaluate, and we tend to manage the person depending on what we see. And with treatment, you see that someone that are having breast milk discharge and not be able to conceive, when you take over and stop that breast milk discharge, conception happens. When someone is having recurrent miscarriages and you stop breast milk discharge, the next pregnancy will stay. When someone is having polycystic ovarian disease and has breast milk discharge, most times when you stop that breast milk, they ovulate and they will go on to get pregnant. So breast milk discharge, known as Galactorrhoea, can affect someone's fertility, but when managed, the person can go on to have her babies. These drugs are not without side effects. So before we give the person the drug, we tend to cancel the person on the side effect, and most times we do it, we increase the doses sequentially to be sure that the person can be able to, the person can handle the side effect associated with it. Most of the side effects are associated with nausea, vomiting, blurring of vision, and most times the person may not be able to do normal duties, and that's why if you just go outrightly to give the higher dose, it may affect the person's work, and we prefer most times to give it at night. Then other things that can cause that hyperprolactinemia, like nipple stimulation, sucking of the breast, we tend to encourage the person, as at that moment, please, your partner should stop stimulating the breast, your partner should stop, or your partner should stop sucking it. Whatever that causes stimulation of the breast, we tend to avoid it so that the breast milk discharge can as well decrease and the person goes on to have a fertility. So thank you for watching to this point. My name is Dr. Nkiruka Bridget. I'm a consultant obstetrician gynecologist. If you have not subscribed to my page, please subscribe at OBGYN Talks with Dr. Adazion. I have a lot of videos that are already uploaded. I have many videos that are going to be uploaded soon. Thank you for following me. Share this video. See you next time for another enriching medical video. I discuss women's health, children's health, and sometimes men's health. See you next time. Thank you.